Hi everyone, my name is Patty Thompson and I will be presenting the exercise pre-participation screening and exercise testing procedure for Case 4. Before we get into the case, I'd like to review why screening clients before giving them an exercise prescription is important. The goal of clearing tests are to determine the client's current physical activity levels, identify any signs and symptoms of cardiovascular, metabolic, or renal disease, and identify clients with those diseases, as well as any other conditions the clients may have. As an exercise professional, we should be better able to identify participants who are at risk for exercise or physical activity-related cardiovascular complications. Chris introduced our client Linda. Here are some of the important information needed to know in order to determine the best testing procedure for her. Linda is a 65-year-old woman who has a previous history of regularly exercising by playing tennis and participating in half marathons. Within the last year, she's been diagnosed with osteoporosis and is currently on medication for it. She wants to begin distance walking again, and her goal is to exercise at least 2 to 3 days a week. The most important piece of information we have is that she has been cleared by her physician. Let's take a look at some of the screening and forms that we might have Linda fill out. The self-guided Part Q form is one we all know and have filled out ourselves. It's relatively simple, comprised of 7 questions that require an answer of yes or no. If answered yes to one or more of the questions, it will require follow-up questions about the person's medical condition. In our case with Linda, she would respond yes when asked if she's been diagnosed with a chronic medical condition. A follow-up question she will have to answer is whether she has arthritis, osteoporosis, or back problems. The Part Q will recommend she seek further clearance before becoming physically active. However, we know her physician has cleared her for physical activity, so that's something that we will not have to worry about. The ACSM Health History Questionnaire and the CVD Risk Factor Form can be beneficial for exercise professionals to have a better understanding of their clients' cardiovascular risks. Although we know Linda doesn't smoke, has healthy blood pressure, and a normal heart rate, we do know that her father had coronary artery disease, and that is something during the screening process that we can determine is a risk factor. The last form we would have her fill out is informed consent. This is important to obtain before exercise testing for ethical and legal reasons. As exercise professionals, we must provide the client with the purpose and risks associated with exercise testing and the program that may follow. These are some of the pictures I took from the ACSM Guidelines for Exercise Testing and Prescription textbook of the Part Q form and the ACSM Screening Guidelines. Alright, let's finally jump into the exercise and fitness testing. The client should have already been instructed to abstain from eating, drinking alcohol or caffeine, and using tobacco products within 3 hours of testing, as the use of any of these could give us inaccurate results. Since our client is on medications, she should continue taking them as prescribed so that the exercise responses will be consistent with the responses expected during exercise training. We will begin by taking her resting measurements and her body composition. Although we already know her heart rate is 75 beats per minute and her blood pressure is 129/79, retesting these measurements are important to maintain consistency. When measuring her body composition, we will be recording her waist to hip ratio. Although we know her current weight is healthy for her age, her waist to hip ratio may indicate a risk for cardiovascular disease. For the cardiorespiratory fitness portion, we have to remember that our client has osteoporosis, so using a cycle leg ergometer as an alternative to treadmill exercise testing is the best option for her. Besides the Astrian rhyming test, a widely used field test for older adults is the 6-minute walking test, where the distance covered is measured and recorded. Since we don't know the severity of Linda's osteoporosis, testing for muscular strength may not be an option. There are no established guidelines for contraindications for max muscle strength testing. However, we can still test for muscular endurance, where we can conduct the push-up and sit-up test. This will help us establish a baseline where to begin her strength training. We will be testing her hamstring and low back flexibility by conducting the sit and reach test. An additional test that we would like to conduct for Linda is the 4-stage balance test. This slide here demonstrates the steps for this pretty simple test. The reason that we need to conduct this test is because our client is diagnosed with osteoporosis. This will help us determine her exercise prescription. If she has poor balance, we will need to include exercises that decrease her risk of falling. This concludes the exercise pre-participation and exercise testing procedures for Case 4. Thank you.